This is a study living with and beyond prostate cancer, and it's a study to determine the impact of increased and variable investigation and treatment of prostate cancer on the island of Ireland. And as mentioned earlier, a lot of this research wouldn't happen without the funding of the Prostate Cancer Charity, and in fact this is one example of such funding. It's also it's based in the Cancer Registry, which is part of Queen's University Belfast, and the funding for some of the work is also provided by the R&D Office of the Public Health Agency for Northern Ireland. So the question is, does more investigation, biopsy, and I know even those of us who don't have prostates were squirming a bit when we saw the video there. So does biopsy and treatment for prostate cancer actually improve men's health? And that's an unanswered question. And why would we be bothered doing this study? Well, we've heard that prostate cancer is the most common cancer among men. It's a cancer which is increasing in the population, largely because of increased detection, but also we've got an aging population. The quality of life of patients is very important. Half of the patients who are diagnosed are in their 70s. Half of those who die are over 75. And quality of life comes into the question maybe more than length of life. We've heard about the physical side effects of treatments, and they can be very distressing, and they include psychological, psychosocial, physical side effects. Previous research on the numbers of people who are affected either as a result of biopsy or as a result of treatment have been limited to very specialized studies. And I'm trained in epidemiology, which is the study of health in populations. So if we're interested in what happens, we're interested in what happens to the population of men, not just a subgroup who may be suitable for a particular trial. Why Ireland? And how Ireland? Well, not only do we have what maybe people think are unique circumstances in that we can produce golf champions, but also why would we consider studying prostate cancer in Ireland? And this is a map of the island, and the border actually runs just along there, and this map shows that the south of Ireland has a much, much higher level of prostate cancer. In fact, it's almost a third higher than Northern Ireland. And that relates to, there's two different health systems. In the south of Ireland, there's much more active testing with PSA levels. In the north of Ireland, they follow guidelines. And so we have a unique situation here where the men, if I go to Dublin, the men don't look any different compared to north of Ireland. So we have sort of a homogeneous population with this unique natural experiment that we are going to exploit to get some answers. These differences exist. The Republic of Ireland patients have more investigation. Their levels of PSA testing increased over the last 8 to 10 years by about 13-fold. In the north, they doubled. Much more cancer is diagnosed. There's more radiotherapy and more surgery and less hormone treatment for these men. So these circumstances allow us to determine the effects on men's health of different intensity of prostate cancer investigation and treatment, and will add information to the debate on prostate cancer screening, which is a very active debate at the minute. So what is this study all about? Well, there's two parts to this. The first part, which is the part we're in the middle of at the minute, is a treatment impact study. And we will recruit men to this who have had treatment up to 15 years ago. And we will be examining the impact of prostate cancer treatments on their physical and psychological quality of life. And we will be sampling 1,500 men, and that will be undertaken during this year. The second part is the biopsy study, which will measure the stress, the anxiety, and also decisional regret of men who have undergone a prostate biopsy. Because then they're on to almost like an escalator of decisions that they have to make about treatment, or if they have decided to go for a biopsy and it's negative, there's always the recurring question that they have, maybe they didn't sample the bit that had the cancer in it. So there are these questions that they ask themselves. And that will be conducted during 2012. We will be doing it by questionnaire survey of these men. And progress to date are that we have appointed the staff, we have achieved ethical approval, we've gone through the rigorous and time-consuming and very difficult process of research governance. We have a steering group who set up, which has met several times with representatives of patients, clinicians, GPs, nurse specialists, researchers, and epidemiologists. And the treatment questionnaire is almost finished. The development of that is almost finished in consultation with clinicians and patients. And we hope also to have some questions in this, additional to what we had proposed, on some of the costs of this to men and the financial impact of it. The expected outcomes are that we will have information for men which will help them to make decisions in the future. So it's for men in the future who will have decisions to make. We will also document current patterns of follow-up, and we'll be able to quantify both physical and psychological side effects across treatment types. And in a way, we will be uncovering a lot of unmet need, we think. We will be doing reports to service providers to identify where services could better target patient needs, and also if there are gaps in service provision at the minute. And we would hope to have peer-reviewed publications on this, which will compare the physical and psychological quality of life for men treated in 2 different healthcare systems with different levels of investigation and treatment. We also hope to be able to provide advice which may influence some of the decisions about screening for prostate cancer. We look forward to receiving the results of this, and we want to say a big thank you to the Prostate Cancer Charity for funding this important research. Thank you.